Hi, this is Dr. Chan at Crown Dentistry. We get a lot of questions about dental emergencies. So we're going to talk about dental emergencies today, and hopefully we can give you a better understanding of how you can best handle them. So when we hear the term dental emergency, that's a pretty broad category. But for the most part, I basically classify anything that's going on in your mouth that doesn't feel like it's normal or it should be that way. Now, that can take the form of pain. That's pretty easy. Obviously, if something's hurting and that's usually a dental emergency, things shouldn't be hurting in a healthy and happy mouth. Something else that could be a dental emergency is something's broken, or at least it feels like it's broken, meaning it doesn't, either the tooth doesn't feel the way it normally does, but it could also be something on the soft tissue. Maybe you're feeling something either on your cheek, your tongue, your lips, the gums, the roof of your mouth that is either the texture feels different. Maybe you're seeing swelling, or maybe you're seeing a change of coloration. Sometimes some of these things aren't necessarily a problem, but sometimes they are. So either way, the best thing to do when you feel like you have a dental emergency is give our office a call. Our staff can definitely talk you through what's going on, and if we feel like there's a need to have you come in and have us take a look, we'll be able to get that done as soon as possible. A lot of times people will break teeth. Almost always they seem to break them at the most inopportune time. But not to worry, if that does happen to you, please do give us our office a call. A lot of times we can take care of it in one visit. At least we can start the process of taking care of things at the first visit. Sometimes we can fix it in one visit, depending on what's going on. It may take multiple visits, but either way, the best thing to do is just to give our office a call so that we can help you out. If you've lost a tooth, either something falls out because it was knocked out, if the tooth still is intact and it's relatively healthy, that might sound kind of crazy, but if it's healthy and it's somehow been knocked out or knocked loose, either through an accident or some kind of trauma, either through sports or falling, there's a chance that we can put the tooth back in and we can stabilize it so it can basically reattach to your gums and your bone. If that does happen, a lot of times we can try to keep it as healthy and vital as possible. And the best way to do that is actually to keep the tooth in your mouth. Another way to do it would be to soak it in some milk. Now, please let me clarify. If the tooth's broken or if it's unhealthy or infected in some way, then obviously you're not going to want to put it back in your mouth. In those cases, we just need to work on trying to keep you comfortable and healthy, and then work on trying to replace that tooth with something better. We have a voicemail here at the office that will answer the phone if we're not in the office. In that voicemail message is my cell phone number. If you do have a problem or you need something after hours, you can call that number and I will do my best to give you a call back and at least talk you through the best way to handle whatever after hours emergency that you're dealing with. So a lot of times people have tooth pain and they're not able to come and see us right away. There's a couple of different options. Usually I tell people to do a combination of ibuprofen, which is Advil, and Tylenol, acetaminophen. So I've found that the best way to manage pain, at least on an over-the-counter basis, is to use these two medications in tandem. So for example, you might take 1 or 2 Advil at the first hour, and then maybe like an hour, 2 hours later, you take a Tylenol. And then you just keep alternating so that you get both of the medication in your body at the same time. Both of them seem to do really well together in terms of managing pain. Now, I know that some people can't take ibuprofen because they have issues with either their liver or their kidney. In those cases, you could also try naproxen or just Tylenol by itself. But either way, those tend to be the best ways of managing pain. There are also some topical gels and pastes that you can put on the area if it's hurting. Unfortunately, those tend to be not as long lasting, and a lot of times they will just fix or at least take care of pain that's on the surface. If something is deeper, a lot of times they won't touch it, but sometimes they can still give some temporary relief. Either way, the best thing is to try and get in and see us as soon as possible. So please just get this call.